Okay, this is chapter 13 of The Poor Man's Way to Prevent Dementia and also to Raise IQ. This chapter here is going to be about mitochondrial inhibitors and Circa inhibitors. Okay, so here, let's go to the chapter now. I got to go in here. So mitochondrial inhibitors, I read and I would come across mitochondrial inhibition. Of course, it's the big thing for fat, especially saturated fat, to inhibit mitochondrial electron transport. This, by the way, is the inner mitochondrial membrane, often abbreviated IMM. It's not shown in this drawing, but there's an outer mitochondrial membrane out here, and then the space between the inner and the outer mitochondrial membrane would be the intermembranous space. These H pluses represent protons. That's a hydrogen with an electron absent from it. And they're pumped into the intermembranous space by these electron transport complexes, which are just assemblies of proteins. And then the gradient of hydrogen protons in the intermembranous space is harvested here at ATP synthase, and when it allows a proton, to come back into the matrix of the mitochondria, then an ATP is made. The phosphate is added to the adenosine diphosphate, as in two phosphates that become adenosine triphosphate, ATP. ATP is like the $20 bill for energy in a cell. And the electrons are passed from complex 1 on to complex 4 like a fireman's bucket brigade towards oxygen. And oxygen is the ultimate electron acceptor. It's got the strongest ability to grab electrons. Okay, and the reason I'm showing you this is I would keep randomly, when I'm reading these papers, come across mitochondrial inhibitor, and of course the big thing is excess dietary fat leads to mitochondrial inhibition, and that causes reversal of electron transport, oh, I'm sorry, I didn't realize my picture was over it. I was looking at the other thing here. So let me get this my picture out of the way here. So that causes then backup of Krebs cycle in the mitochondrial matrix, backup of glycolysis in the cytoplasm. All right, so why am I showing you this? Because I went then back and went through all my biochemistry books and stuff, my regular medical books, conventional textbooks, and there was nothing on mitochondrial inhibition. And I knew it couldn't be correct, so I just started going through all the literature on mitochondrial inhibitors. And the point is, I found over 50 of them very quickly. And so that's what I've said many times, is that the conventional textbooks, they're all wrong. They're all 50 to 100 years out of date, and they don't even include the most important topics in the related fields. You need your mitochondria. This is where all your energy comes from. The vast majority of human energy comes from this mitochondria. And so the fact that there's a lot of things that inhibit, that's a super important thing. That should be like the main topic in biochemistry for medical students in college pre-meds, but they don't learn anything about this, nothing. Okay. So then you would ask, well, how common are these things? Well, a lot of these things are quite common. Look at Tylenol, acetaminophen. Okay, not only is it toxic to your liver, it's toxic to your mitochondria. Because, people tend to think, oh, Tylenol is no big deal. No, it's actually has powerful side effects. That's bad. What are some other things that are common? Look at this. This is GP, glyphosate. That's what's one of the major active ingredients in that Roundup sprayed on the GMO non-organic soy. And it's also sprayed on other non-organic crops. It can even be sprayed on non-organic beans and oats. That's why it's another advantage to getting organic. You can't spray that on something if it's organic. So it inhibits complex 2 of electron transport. That's bad, okay? It does a lot of other things that's bad too. It's sort of an antibiotic. It originally was used as an antibiotic, and so it can, remove kill off a lot of your good gut flora and predispose you to leaky gut. That's not good. What are some other things in here? Statins can decrease the function of coenzyme Q. Great. So people think statins are such a great medicine. Oh, to lower your cholesterol. It's so easy to lower your cholesterol for almost everybody. There's a few exceptions with familial hypercholesterolemia type diseases, but why would you want to take something that inhibits your mitochondria? Okay, it can weaken your muscles. All right, I think it's pretty overrated. Okay, what else? Then, I don't know if if you study Parkinson's disease, you'll hear of something called MPTP, all right? And what that was is a bunch of drug addicts were trying to make this artificial type of heroin, and they accidentally made this compound here, MPTP. It inhibits complex 1 of mitochondria, and guess what? It causes Parkinson's disease very rapidly. Okay, so why do I find that funny? Because the antipsychotic medicine Haldol, and there's haloperidol, and there's other antipsychotic medicines that do this, they'll also inhibit complex 1, and they'll also, more slowly, they'll gradually cause Parkinson's disease, or a type of drug-induced Parkinson's. So, why would you want to take that medicine? I talked previously about soteria and how schizophrenics do better the less medicine they get. Other than, their acute psychotic episode, they might need some. All right, well, what else? Well, then another thing, too, a big popular drug for treatment of, non-insulin dependent diabetics is metformin. And I've had several different, board certified fellowship trained physicians come up to me and say, oh, what do I think of metformin? They've heard it increases longevity. Should they take it? I said, are you a stupid idiot? It's a complex 1 inhibitor of mitochondrial electron transport. You really want to be taking something to inhibit your mitochondria? The reason that's funny is a lot of the theories of what causes aging is decreased mitochondrial function and reactive oxidative stress. It's not a good thing, okay? And then there's other real common medicines also inhibiting complex 1. Mercury, which is a typical contaminant of high fructose corn syrup, will inhibit it. Furosemide or Lasix, common drug used to treat fluid overload, and sometimes it'll be used with cardiac problems, hypertension problems. Let's see what else in here. SSRI, serotonin selective reuptake inhibitors, including trazodone-like drugs. So these are things used to treat depression. So that's really going to help you be undepressed, to decrease your ability to produce energy by inhibiting your mitochondria. Great. And it's not just trazodone. Here's sertraline, and there's other ones. Okay. Another thing is some of these endocrine disrupting chemicals like BPA, bisphenol A, they will also be damaging to the inner mitochondrial membrane. PFOA, like on the nonstick cookware, can be harmful in this way. And so this is what I'm saying too, is people want one thing. We talked recently about, some of the paleo carnivore types are trying to say, oh, the reason people are fat and sick, it's because of fructose and high fructose corn syrup. And then there's other paleo carnivores trying to say everybody's fat and sick because of omega-6 cooking oils. And what I'm saying is, yeah, both of those things are bad, but all of this stuff, it adds up. And people's health gets nickel and dimed. And so the first step to getting better is becoming aware of what's diminishing your health, and then you just avoid these things. Here's the atrazine, the estrogenic chemical that's sprayed on the corn crops, the non-organic corn crops. So you want to avoid that. Here is HNE. It's inhibiting, by the way, atrazine is inhibiting complex 3, like right where you would block electron transport to cause diabetes. Great. And when you block this, you're also going to increase the amount of reactive stress because you're going to leak more electrons down onto oxygen to produce superoxide anions, which if you've got a lot of overloaded with free iron, you can get Fenton reactions. That produces hydroxyl radicals, which then cause lipid peroxidation of the inner mitochondrial membrane. Okay, so the interesting thing about this slide, and why am I going through it? Because these are all common things. And like I said too, your conventional medically trained doctors, they don't know anything about epidemiology, they don't know toxicology, and they don't know nutrition. But those are the 3 most important subjects in health. So it's funny, but they're not trained in the important subjects in health. Any of them could read these books and learn this stuff if they wanted to, but most of them aren't even aware of how important it is, and that's why they don't ever have the time, energy, or motivation to do it. Okay, what are some more interesting things on here? Hydroxynonenal is the byproduct of omega-6 cooking oils after lipid peroxidation, and it's relatively common, and it'll inhibit complex 5, where ATP synthase, so it's going to decrease your ability to produce energy. It's all bad. Lead can still be a contaminant found in some places. It's inhibiting this process. F-, fluoride, that's in the water. That's inhibiting complex 4. So that's quite bad. It's neurotoxic. It's toxic to your mitochondria. That should not be in the water, okay? Just in case, some people who are very naive and gullible, they're going to tell you, oh, well, it's so good for teeth. It's actually not that good for teeth. It has a little bit of a benefit for teeth, but it has tremendous, numerous side effects, okay? And if it was only good for teeth, you would, just rinse it on your mouth and spit it out real quick. You wouldn't want to drink it and ingest it into your body. It does lots of bad things besides being neurotoxic and lowering IQ. Oh, another thing, here's these anti-seizure medications. Here's a couple of them, like valproic and a couple other ones. And, I have a neurology friend who told me, he says, yeah, all these things, they slow down the brain and they decrease the incidence of seizures, but they also lower the patient's IQ. And some patients who are refractory to medications for treatment of seizure disorder, epilepsy, will slow down their seizure rate when they eat a ketogenic diet. And so people think, oh, isn't that great? The ketogenic diet slows their seizures. Yeah, I mean, it's good that it helps those patients potentially there. But what I would say is, one of the reasons why I avoid the ketogenic diet, I want my brain to be fast. I want it to work well. Okay, what are some other things on here? Excessive dietary, these are oxidants, iron, zinc. Zinc, small amounts of it are good. Small amounts of iron are good. Small amounts of copper are good. Aluminum's never good. It's always bad. So all of these things can have a toxic effect on your mitochondria. You never want to eat processed food if you could avoid it. Multiple food dyes in processed food are toxic to mitochondria. Another thing is preservatives in processed food. They pretty routinely will put antifungals into things because antifungals, prevent mold growth, so helps the product to not spoil. But the problem with a lot of antifungals is they're inhibitors of mitochondrial electron transport. And any things that inhibit mitochondrial electron transport, they increase your risk of becoming demented. That's why they're in this book. Because whenever you have a problem in your neuron, what does the neuron do? It tries to heal itself. How does it try to heal itself? For example, high cytoplasm calcium, let's say from excess glutamate. So the mitochondria will crank out more ATP, and the ATP will pump the calcium out. But what happens to that neuron if the mitochondria is inhibited at several different locations and it's not able to produce enough ATP to pump out the calcium? Well, then the calcium will stay higher, get higher. The neuron will go into excitotoxicity, meaning that its metabolic rate exceeds its energy production, oxygen, glucose delivery, and energy production. Then that neuron will die through apoptosis, programmed cell death, a gradual process, and it just gets recycled. And you keep on losing all these neurons, and then you become cognitively impaired. Okay, and that's what I mostly see when I see demented patients. I see them all every day. They basically just have a shrunken brain. Sometimes I'll see a bunch of silent strokes or an old big stroke, but the vast majority, I just primarily see a shrunken brain, atrophy, an atrophic brain, a shrunken brain. Okay, and again, they're extraordinarily common, these things. Cadmium, you can get that from brake pads too. That's why, sometimes people say, well, why don't we eat at this sidewalk cafe on a busy street? I go, no, I don't want to be by all these cars and their exhaust and the cadmium coming off their brake pads. No, I'm not sitting here. I pretty much do whatever I think is right. I don't really care that much about peer pressure. I always say to myself, I'm a genius. Why should I care what idiots think? And I mean, that's a little bit of an arrogant statement, but there's truth in it, because if I'm with my kids, they'll always freak out that I'll do things like I won't allow somebody to put my food in aluminum. And they're like, oh, be quiet, Dad, you're embarrassing us. I'm like, no, I'm just doing what I think is the right thing to do. Anyways, TCE, trichloroethylene from dry cleaners, liquid paper, degreasers. You want to avoid all these chemicals. Anything that smells bad usually is toxic to your body. Anything that kills germs is going to also kill your human cells most of the time. So you want to avoid that thing. And if you have to work with a chemical for your job or something, then at least open the door, open the window, have a fan or something. Ventilate the place so you decrease your exposure. PCBs are also, endocrine disrupting chemicals. So when I say endocrine disrupting chemical, I'm usually meaning estrogen disrupting chemical. Propofol is a common sedative. I wouldn't want these. I went for a colonoscopy. Gosh, it's like almost 20 years ago now. And, I said, oh, fine, just do it. No sedation. That way I could drive myself home. And then, my family's making fun of me. Oh, you enjoyed it or something. I'm like, no, because I know the medicines they use to sedate people, like Versed, for example. It removes your memory for a while. What if my memory doesn't come back to full go? I don't want any of those drugs. These antibiotics, aminoglycosides, a very powerful antibiotic. Quinolones are a common antibiotic that's used to treat like a CNS infection for crossing the blood-brain barrier, but also to treat a testicular infection or an ovarian infection because they'll cross the testicular blood barrier and whatnot, but they're also toxic to your mitochondria. Okay, and they call them fluoroquinolones because the fluoro means they got fluoride on them, which is also bad. Beta-lactams, type of penicillin that has a wider ability to avoid some problems. Some of these other ones here are not specifically mitochondrial electron transport inhibitors, but they inhibit enzymes of Krebs cycle or that are relevant to it. Like alcohol inhibits, for example, pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase. So alcohol is bad. I recommend zero alcohol, not one drop. There's nothing good about it. All that stuff about 1 or 2 cups a day was all BS based on something called the survivor effect of previous alcoholics that screwed up the data sets. Okay, you know, what's cool about getting drunk and stoned? It's just causing damage to your brain cells. Okay, arsenic, we talked about that previously in lectures on rice. I don't want to go into it now, but you just, you know, get the rice not grown in the southeastern United States where they used to spray arsenic pesticides at the boll weevils, and rinse it twice. Okay, what else? White rice has less arsenic than brown rice. That's why I prefer white rice. Traumatic brain injury also inhibits pyruvate dehydrogenase, so you want to be careful in the acute setting after traumatic brain injury because they're pretty vulnerable. They also get leaky gut in that setting. Silver also will inhibit like malate dehydrogenase. So anyways, there's a whole bunch of these things. Oh, flame retardants. That's also on like the blue surgical gowns for doing procedures. If I'm doing a minor procedure, let's say I'm doing a biopsy, I won't wear a surgical gown. I'll just wear some barrier gown because I don't want the flame retardants in there, like the brominated flame retardants, all right? Mitochondrial inhibitors, who needs that? They're also estrogenic disrupting chemicals. And I think that's also part of why the male population in the United States is highly feminized. Gosh. There, you know, if you read the history of the United States and you read sort of like the brave, strong, macho men of the past in America, it's like, are we talking about the same type of people? Nowadays, the modern men in the United States have been so feminized, it's sad and pathetic. Compared to, I'm reading currently a book about the history of, you know, 1776 and stuff, and it's like, they're just macho, brave, all these guys, and now, the United States, gosh, the men are so messed up, it's sad and pathetic. Sperm counts are dropping through the floor, and a lot of it is stuff like this: is atrazine, is fluoride, the aluminum, all these toxic chemicals in the food and the environment. Okay. Okay, this is just some more of these toxic chemicals. We went through all these. And like I said, I didn't learn anything about mitochondrial inhibitors. I was like the best student in the United States in biochemistry out of all the medical schools. One of the best, if not the best. It's hard to know exactly based on how they test them, but certainly one of the best. Let's see here. Okay, just a little bit on decreasing your risk of excitotoxicity. So basically avoid all those mitochondrial inhibitors because you're more vulnerable to excitotoxicity when you don't have enough energy to pump calcium out of the cytoplasm. Eat your plant foods. All the good stuff comes from plants. Most Americans are deficient in potassium and magnesium, vasodilators, because they come from plants. Magnesium is also needed for all ATP reactions. You need a lot of potassium to maintain your plasma membrane gradients on your neurons. We eat too much sodium, and so instead of doing what we're designed in nature to eat about 20 times as much, 20 or 25 times as much potassium as sodium. Richard Moore, who devoted his whole life, says just try to get at least 5 times more, preferably 10 times more, and you'll probably be okay. That means 5 to 10 times more potassium than sodium. But it's really better than to have it higher. Our ancestors probably ate about 25 to 1 potassium relative to sodium. And our kidneys are made to excrete the potassium. They're made to conserve sodium. So that makes it more challenging when you eat a high sodium diet. All right. What else is interesting here? Magnesium's in the center of chlorophyll. Okay, so you eat the plants, you get it right there. We also tend to be low in nitrates, the precursor for the vasodilator nitric oxide. Comes from plants, especially from your greens. We also tend to be low in antioxidants. Where do you get those? From plants, because the plant has to make antioxidants to survive out in the hot sun. Okay, what else do you want to avoid? You want to avoid caffeine, because caffeine is basically an excitotoxin, meaning that it increases glutamate transmission in your hippocampal neurons, and it simultaneously is a vasoconstrictor, decreasing the blood supply to the brain, you know, anywhere from, let's say, 15 to 27%. Stress is, you know, just like caffeine, increased cortisol, increased catecholamines, and they're both going to crank up blood lipids, which is going to also have a decreased tissue oxygenation effect. Get your sleep because it does the same thing as sleep deprivation, same hormones as stress and caffeine. Filter your water to get rid of your endocrine disrupting chemicals that can be mitochondrial inhibitors. Circa is sarcoplasm endoplasmic reticulum calcium ATPase. It's the enzyme that pumps calcium from the cytoplasm into the endoplasmic reticulum. In a skeletal muscle or other muscle cells, you use the word sarcoplasm, but for neurons, we're just talking about endoplasmic reticulum, which is a location to store calcium inside a cell as a reservoir. And when you have high cytoplasm calcium, one of the places you pump it out of the cell into the extracellular space, but you also pump it into the endoplasmic reticulum. So you need that enzyme working, and both of those processes require ATP. So you need mitochondrial function to be able to do that. I first started learning about all this Circa stuff, especially when I read this book by Brundy Brody, The Calcium Connection it was called. She's a real smart lady who had a child with this chronic fatigue syndrome, and no one could figure it out. And she was pretty wealthy. She hired these scientists to try to figure out why her kid was sick, and they came up with the fact that he had a real hypersensitive Circa enzymes in his neurons. And once she avoided all the Circa inhibitors, the kid did great. He ended up finishing college. He's got a degree in some type of engineering. Okay, pretty much anything that smells bad is going to be toxic to your brain. All these paints, glues, air pollution, exhaust. A lot of painters end up, cognitively impaired. People working with glues end up cognitively impaired. Stupid people that inhale glue end up cognitively impaired. There's a lot of air pollution, and some of it is those trails, of aluminum. Okay, not good. Not good for the soil either. Don't want to be smelling car exhaust. For some reason, young people have a tendency to think they need to warm their car up a prolonged amount of time, which I think is kind of stupid. There might be some car where you have to do that, but I've never warmed up a car in my life. Let's see. Avoid processed food. Processed food's full of toxic chemicals, often Circa or mitochondrial inhibitors. Try to eat organic if you can. Avoid unnecessary drugs. They all got side effects. And the problem with a lot of these conditions is you can end up in a vicious cycle whereby the decrease in the Circa is going to lead to insulin resistance, and then when you have increased insulin resistance, it's going to end up causing glycation, advanced glycation end products that are going to damage Circa. So it's a self-reinforcing vicious cycle where it just makes itself worse and worse. And in general, Circa inhibition correlates with hemoglobin A1C. So the higher the hemoglobin A1C, the amount of glycated hemoglobin in your red blood cells, the more likely that your Circa is inhibited. So if you do the things that prevent diabetes, you're also doing things that are probably going to protect your Circa enzyme and your ability to manage calcium inside your neuron cytoplasm, to be able to pump it out of there, to turn the cell off, which is what you need to do to not go into excitotoxicity, programmed cell death. The next thing I'm going to talk about is Martin Pall, and Martin Pall is a real genius. But we'll go. That'll be the next chapter. So, anyways, I just was making the point those mitochondria inhibitors are real common, and again, like, what's the rule of thumb to go by? Just be a minimalist. Be real simple. Eat the low-fat, low-sodium vegan diet. Live like Adam and Eve, but keep your heating and plumbing, and avoid all these extra chemicals as much as you can. So, anyways, hope that's helpful.